So it's my pleasure to bring you chapter 2, workforce safety and wellness. So let's open this up and take a look at chapter 2. So again, hopefully you've already watched chapter 1. You notice how the format is set up where we'll go through the slides. I will encourage you to go through the review questions as well. There's also in each chapter that you are the provider. And so there's some good examples, and it ties along with the actual presentation that we'll look at now. And the example for chapter 2 is you respond to a child who's in cardiac arrest, and the mom is yelling at you, asking, why aren't you doing this? Why aren't you doing that? And that's some of the material that we're going to look at right now. So workforce safety and wellness, two components really. The first is understanding you need to take care of yourself, right? As a provider, you're the one that has to deal with these calls. The training that you're going to go through will recognize certain hazards, the personal neglect, environmental, but again, keep in mind, this can be a mental and physically taxing career. So wellness itself, as we define wellness, and a lot of this ties directly into our resiliency training, so we might as well talk about that now as well, but it's at complete mental, physical, social well-being, right? As you get into some of the later chapters, think of the process of homeostasis. Homeostasis is this great balance that your body has to keep itself functioning the way it should. But the same thing goes. If you lose part of your mental health, or let's take your physical health out of it, or let's create some awkward social situations for you, then that's going to have an effect on your general or overall health. The state of wellness must occur at work and at home, right? It's pretty evident when someone's at work and they have hard things going on at home, they take that out on partners or patients. And again, the same thing if you're having a hard time at work. Your family is there to be a support system, not someone that you can just, yell at or take it out on. There's better resources for that. So, of course, you do all have the potential to work in certain stressful situations. Stress is different based on the individual, though. What's stressful for one person may not be necessarily stressful for the other. And again, it's just this recognition of some, potentially stressful event. How does it play out on you? And then what in turn does that do to your partner? One of the things to keep in mind is the calm demeanor, right? That's good for you. It's good for the patients. It's good for the bystanders. We don't want to be the ones that are running in and screaming and telling everybody what to do. Again, focus, right? One of my first partners, shout out to old JP. JP told me that no call ever will go perfectly. Right? There's always something, whether it's a mapping issue and you turn down left on this street, you find out that now it's blocked and you have to go around, something happens to your patient. That's why we always refer back to airway, breathing, circulation, those key life threats. It's the same way on a call, right? You don't have that expectation that everything's going to always be perfect. Makes it a little easier to adjust when there are those slight bumps in the road. Scene safety, we'll look at that as well. Each of the calls that you run should always start off with, number one, I'm making sure my scene is safe. Number two, I've donned the appropriate personal protective equipment. And then, of course, taking care of the patient themselves. So strategies to manage stress, some of these are more valid than others. I will let you determine which ones work well for you. Some of the things that are certainly harder to do are changing your partners, right? If you and your partner aren't getting along, and you'll see later on in this same presentation, there's we all have to be diplomatic, right? Just because I'm working with you for an 8, 12, or a 24-hour shift doesn't mean we have to be the best buds and go out and eat dinner every night, but there should be some certain level of respect that we give to each other. The cutting back on overtime, again, that's always a hard one because, right, why are you doing the job? Well, you're doing the job because you want to help people, but at the same time, it is nice to get that thing every 2 weeks that they call your paycheck. Talking about feelings, awesome. That's probably one of the easier ones to do with this, to find that person that can become your sounding board. If it comes down to it, there are multiple agencies in the area where you can actually seek that professional counseling. That ties into resiliency, so it's a great place to mention it, is that there's often a stigma attached to that. Yet the only way we're going to get over that is to let our new and incoming students know that that's certainly okay, right? Just like if you were a diabetic or if you were having chest pain, there's a physical ailment, there can be something wrong with, you know, whether it's PTSD or some other issue that you're dealing with that can be, I don't want to say fixed or at least managed in some way, but not obsessing over frustrating situations. That's a big one. And again, I can give you a simple example from class, that person that gets the 99 on a test and it just killing themselves mentally because, oh, I'm not perfect, I didn't get the 100. Again, that's fine, but you need to learn to let some of those things roll, right? This is a long class, it's a long process, and hopefully you're all going to have long careers out of this. And we just don't want you to, you know, get stuck or obsessing over some situation that you honestly can't fix at this point in time. The expanding your social support system, again, by that it's having friends outside of EMS, right? If you live in a fire station and you're always running calls and you never have that break, then that does have the potential to wear you down as well. Minimize physical response to stress, and some of the ways to do that are simply, well, we'll look at those here. I was going to say working out, sleeping properly. Sleep is a huge thing, right? It helps you reset that computer, known as your brain. Balancing work, family, and health. Again, you do have to be, I don't want to call it selfish, but you have to make sure you take time for yourself. Okay? That is huge. And eating right and getting the exercise you need to allow you to do a physically demanding job is important. Some of the things on infectious disease, communicable diseases, that some organism that enters your body, right? That is an infectious disease. You can have a communicable disease where it can be spread from person to person. One species to another is actually an example of how something could be vector-borne. Tick and Lyme disease is a prime example of that, where that tick carries a disease that can transfer to you. So we always take the steps to minimize your infection risk. And that goes along with gloves, it's goggles, it's everything that we're going to roll through as we do this. Now be aware of the different routes of transmission. Direct contact. Give you an example for direct contact. Somebody sneezes directly into your face. Well, that's disgusting, but that's an example of a direct contact. Now, if that same person were to have sneezed on your ambulance gurney, and then later, before you had a chance to actually clean it, you put your hand on that or you scratch your face, that's an indirect contact. The airborne transmission, foodborne, botulism, there's different ways that disease or organisms can get into your food. And then, of course, the vector-borne transmission. Again, I just always associate ticks, Lyme disease with vector-borne transmissions. How are we going to reduce this? All right, we tell you, hey, this is a potentially hazardous profession you're getting into. So there are certain recommendations from the Center for Disease Control that involve your personal protective equipment, right? The environment that you work within, making sure these things become decontaminated. It's huge. And the special circumstances could be there's a reportable incident. Nowadays, we're talking about COVID or COVID-19. If this patient is suspected of having this, again, having that protective gear on and making sure you notify the hospital, because we just don't want to throw that potentially contagious patient in the middle of an ER where there's 15, 20 people walking around them without the right equipment. Proper hand hygiene. If you have not heard about proper hand hygiene, then I do not know where you have been. So before and after patient contact, obviously, that's taking care of potentially direct and indirect contact. One of the ways that another indirect contact can happen is if you had your gloves on and you were touching this person, and then without changing your gloves, you go and touch another patient, right? Gloves are single use. There's a fantastic video on this channel, something entitled Gloves Are Not Immunity. Also goes through the proper technique for taking that off. But as I look through these, there's a couple of key pages that come to mind. And if I were a question, I might ask you, well, if you don't have the ability to wash your hands, what should you use in the meantime? And that's where that Purell comes in, or not a particular brand, but just some alcohol-based waterless substitute for that. And all ambulances should carry that. Gloves are awesome. Gloves are not immunity. Recommendations are nitrile gloves. You try to get away from the latex gloves. Although those do offer protection, there are people with some pretty sensitive allergies to latex out there. So again, I want to keep myself safe, but I'm also mindful of what something that I have could be a negative for the patient. Removing gloves, that special technique, and just to understand, we take from the cuff, we turn that inside out. We do that with the other glove. Please go back, watch the video on that one. It's mildly entertaining for you, but do not contaminate yourself with some material you have on the glove. Don't grab your keys, don't grab your drink, because those are all things that now we potentially put onto that glove or the surface of the glove. Eye protection, as situations get messier, it's better to have higher levels of protection. The prescription glasses are not adequate because they actually don't have the side shield. This is an ANZI standard, but face shields are great because they come down and cover that. Goggles, these are some actual examples of some safety goggles, which are awesome. But if you have to wear that old science lab goggle where it has that string that's really pulling tighter in your face, it's not comfortable. We understand if it's not comfortable, you're probably not going to wear that the way you should. So the things that are out there now tend to be more comfortable for you. Gowns, yeah. When I started thinking about gowns, this would be during, help facilitating the birth of a child, right? Things that are under high pressure. So of course they may not be practical in many situations, but as that scene or situation gets messier, then it would certainly be appropriate to put that gown on. There's actually a gown that comes in an OB kit because of that expected messy scene that you're actually going to be on. So masks. So it's a good time to remind you that, again, coming to class, the current protocols dictate that you will have some type of a simple surgical face mask on. We don't need the N95s if we're respecting your distance, but when you're performing ventilations, and that's the different type of mask, that's an actual barrier device with a one-way valve that's hopefully going to protect you from that patient and anything that's aerosolized coming out of their lungs. So masks are awesome. Wear your mask, and even though it may not be directed to for your safety, it's for that potential safety of others that we're worried about as well. Needles and sharps, again, as paramedic, I may start an IV. I shouldn't just leave that needle on the bench seat or somewhere on the patient. We want to avoid these sticks, right? So we do have to be smart about that. Dispose of these. This is what's referred to as a sharps container. These are, and I can't think of any other color that a sharps container is, but that red that you're seeing there. But as long as it's indicated, yes, this is where your sharps go, that's where you should drop that into. Now, as far as the employer goes, and we do have some responsibilities for our students, we have an exposure control plan that once you get out and you start working in the field, each department has their own. But if something were to happen while you were in, again, I would say clinical setting, on the rotation with a fire department or something in class happens, we need to know that so we can start documenting that. Because as you're going to see in chapter 3, if you don't write it down, it didn't happen. So again, this is just getting you into the habit of working to always protect yourself. The infectious control routine, this is just cleaning up the equipment that you use, right? This is a huge part of the job, especially now when you're dealing with this, potentially things coming out of someone's respiratory system that can stay on a surface for who knows, whether it's 5 minutes or 5 days. We still want to make sure that ambulance is as clean the first time you get in it as when you leave it at night or in the morning or whenever you happen to be done. But when you do clean that, it's great if you can do that in the hospital. There may be some other recommendations based on your own agency, but in the hospital, there's places to drop your contaminated or soiled linen, right? It goes directly into their cleaning area. But above all else, we have to keep ourselves safe. Now with immunity, this is something that's come up lately. People are looking for antibodies for COVID, but what this is looking at is that you may not become infected. And this is why if you had the TB skin test or they're testing for Other things when you do your immunizations, maybe there's a titer that you have to get, but the best thing you can do for that is to protect yourself, right? This goes back to sleeping and eating right, and stay up to date on your immunization. And it's very likely that you'll have a TB skin test every year just to make sure that that's something that you're potentially not contagious for, or something that you could spread to others. If you are exposed, blood or bodily fluids, this comes up again. I will say, yes, turn this over, patient care, to another provider, clean that exposed area. There is a potential for abandonment on something like this. So as long as you turn that care over to another provider, then you can go ahead and continue with these other steps, cleaning the exposed area, rinsing the eyes for potentially up to 20 minutes. Then obviously the infectious control plan officer needs to be notified, and you complete that report. They can do some baseline testing on you and really track if this is where you potentially contracted whatever it is that you were exposed to. Scene safety, we won't kill you with scene safety, so we might as well start off early in the chapters that you come first. When does that start? Well, as soon as you're dispatched and driving safely to the scene, but continue to protect yourself once you are on scene. This is a pretty good example that you can see the people wearing their reflective vests. In this case, they're wearing turnouts. But people don't always stop just because the flashing lights are on. So keep your head on a swivel, if you will, and know that these situations are dynamic. They're ever evolving. They're going to change, and you want to make sure you are safe. Hazardous materials, you'll do some things later on as well in this class where you look at the, wow, that just totally escaped my head about what this is, or the NIOSH, or the guides for hazardous materials. It's a quick and easy look up to see, hey, what is that container carrying that's now leaking all over the ground? You probably don't want to rush in and walk all over that. There's electrical issues and power lines. With the power lines, TEP, right? This comes into your additional resources as a consideration. Same thing with fire. This is training you to do EMS. This is not the fire course. So when it comes to fire and even the crashes, there's bent metal, there's glass at these scenes, there's fuel, maybe there's fire. They may need someone to actually extricate someone from that crash. So I'm not a fan of how they're wearing the turnout gear. Turnout gear typically is something that's a fire side of the house. But yeah, you'll have gloves, helmets, boots, the eye protection, even sunscreen becomes an issue when you work in an environment like this. It gets hot, yeah, make sure you keep yourself hydrated. That's another way that you can protect yourself. So these are some of the colder weather types of outfits that people have. And, there's big duty jackets and everything. It's not always going to be the turnout jacket. Now, when it comes to the critically ill, injured patient, how are we going to do with that? What are we going to do with them? Let the patient know. This is just like any other patient. Who you are, and what are you doing? Hey, my name's Brandy. I'm a paramedic here to help you out. Great. Let them know that you are attending to their immediate needs. There's certain, cycles that people will go through, and they may not always be the most responsive or welcoming at that particular time. But we don't take this personally. We have to understand they've been in a pretty serious situation, and we're just there to help. So these are some of the responses that you can see from a critical patient, starting with the anxiety, right? How about the pain, right? They have bilateral femur fractures. I'm guessing that's going to be pretty painful. They could be angry, if it's been, someone that's experienced some stroke or cardiac issue. Maybe they've been depressed for a while. They're dependent on, we could be medications. It could be the loved ones around them to take care of them, or even the guilt that they have that they're going through this, or, oh, I don't want to call these guys. That's just part of the deal. Now, avoiding sad, grim comments. This is where everyone, and I'm glad I can give you this warning now, should look up trite, right? Avoid trite comments because they may appear, so fill in the blank. But orient the patient, let them know who you are, where you are, what you're doing. Honestly, being honest, that's something that's carried with every patient. allow for hope. And of course, if you need to, we want to contact the family member. The ill, injured, or critically ill child, again, we'd like to have an adult with them, right? Just because there may not be an adult on scene doesn't mean you don't treat that patient. But if there is a parent or the caregiver that's around, then we definitely want to make sure they're going with you. The death of a child, obvious tragic event, helping the family in any way that you can. And then sometimes that may just be stepping back and making a call so you bring someone else to the scene that can talk to them about that. And death and dying, there's different ways that people die. The sudden death is the one that typically causes more angst, concern, and fear. If it's a prolonged or terminal illness, such as a hospice patient, they've been in hospice for the last month, those are things that you tend to know that are going to happen. So again, there are times where you're going to face death. Now, in the stages of grief, something I'll say about these is that these can really happen in any order, right? It doesn't follow the denial, anger, bargaining, depression, acceptance. It doesn't always follow that path. So we're calm, we're reassuring to our patient, but realize that they're going through something. This is an example of, potentially wearing that patient's shoes for a while. The role that you're going to be asked to fulfill, is there something you can do to help them? There is something through, I know it's an ACLS and PALS, and, don't, if you were the one that had to report this, we don't tell them that the patient is gone. Gone, where'd they go? Using the word dead or have died is actually the appropriate terminology for that. But again, allowing them opportunities to grieve and stepping out, right? If the family just suffered the death of this, let's call it SIDS, the baby 6 months old, they really don't need me hanging out there telling them, what can I do for you, right? You kind of just have to take your clues. Each scene is going to be, different from the next. So we're going to have to rely on what's referred to as your emotional intelligence. And if you're able to do that, awesome. You can kind of read people. That's part of this whole career, is reading people, knowing when and when you're not going to be able to approach them as easily. So the things to avoid saying, just off of table 2.7 in your text, I'm not going to read all of these. I just will say avoid trite comments. Avoid trite comments. It's not on these exactly, but when in doubt, I'm sorry for your loss is really the best thing you can say. But if you have concern or fears that you can't say something right, maybe that's your partner's time to shine. The recognition that it can be a high stress job, of course, people are going to respond to stressors differently, but general adaptive syndrome, adaptation syndrome will come up again. And initially there's this alarm response to stress, right? Something happens, whether it's a tone going off or you hear, potentially a gunshot. There's your reaction and resistance to this. And then that's followed by the recovery or exhaustion phase. So 3 phases with the general adaptation syndrome. Know that as well. What does your body do in times of stress? It's actually fascinating how your whole body works. And it's exciting as we move towards that physiology chapter in the human body, that pupils are going to dilate, skin cool and clammy, the tensed muscles, your glucose level goes up. So it's giving you that energy to potentially, and you probably heard this term, the fight or flight response. Well, this is your job, so we are there. I don't want to say fight, but you get the idea. When most people are running away from that scene, the expectation is that you're going to the forefront of that. Decreased blood to the GI tract, that's just a process referred to as shunting. It gets the blood to the heart and the lungs so it can deliver that up to the brain so you can continue to process information. So these are some of the stressful situations we look at. I'm definitely going to agree, dead or critically ill, injured patients. Again, it's a 98-year-old that you're transporting from home to hospice and that person happens to die on you. Okay, that one's probably not as tough as responding to the 2-year-old that crawled into the pool and has been underneath water for 40 minutes, right? Those are both potentially stressful situations. Angry or upset family members, bystanders, and the unpredictability is really why a lot of people do this job. I guess that's a good stress. We can call that a eustress versus a distress. those are two different types of stresses. And obviously distress is something we try to avoid, but the eustress is something that gets you going, gets you motivated, and allows you to perform what it is that you need to do. So this too will come up, the different stress reactions, and it's in the name, acute, right? There's two ways we look at things. It's an acute issue, or potentially it's a chronic issue. Acute means it's actually happening during that stressful situation. The delayed stress reaction means you got through that, but it's going to manifest itself after. And then the cumulative stress reaction, it's that prolonged exposure to certain events. It's the proverbial straw that broke the camel's back, right? There's so many things that you've experienced, and then, oh, potentially you have this blowout, you release all this stuff, whatever it is, that can also be recognized as PTSD. Post-traumatic stress disorder. The biggest thing in the EMS agenda for the future was making sure these components are recognized. So critical incident stress management, something that should be done no later than 24 hours after a stressful situation, was really designed to decrease the likelihood of PTSD, right? That's why the CISM is out there. It's to decrease the potential of PTSD. PTSD is something that causes us to lose people, every year, whether it's just attrition and they don't do the job, or of course the worst part of that is the suicide rate. Suicide rate in EMS is much higher than if you were an accountant per se. So again, just know that's out there, but this is why we want you to have the resources. The warning signs of stress, and there's a couple ways to think of this. This could be on yourself, or this could be seeing this in someone else, your partner, your, different co-workers there. And so irritability, right? Family, friend, oh, you're grouchy, what is it? And again, EMS people have a harder time admitting this, but that's becoming so much easier, right? There's resources out there. Everyone has something on it. It's called the EAP, Employee Assistance Program. Again, these are confidential things. Most people don't want to seek that help because they think it'll give a sign of weakness. It's actually quite the opposite. To be the person who goes out and helps people and helps people and helps people, and you can realize in yourself that this is something you actually need, that's great. Those are the people that make it through this profession for many, many years. Isolation, locking yourself up. Again, these are all things you can review as well, but think about it. You could have had a stressful time. Maybe we're all going through a stressful time. For the last 8 weeks, you've been inside. How are you treating each other? How are others treating you? So again, just one of the things to think about. So it is advisable to use, and now I'm actually going to go back. Well, you just have to bear with me on this. So I'm going to go back because I noticed I skipped a slide. There we go. On the stressful situations. Was that a stressful situation? Should I freak out? Should I break my computer? No, I realize that even as we're doing these lectures, things are not going to be perfect. The back door actually came off the, I don't know what you call it, a hinge or something. And so right now my father-in-law is somewhere fixing the door and he's going to bring it back and he may walk right in front of us. But again, things you can adapt and get over, that's an example of resiliency. So be careful in the words, the actions that you're using, right? We don't want to say something stupid. And that's why I say, if you don't know, it's better not to say anything. Your whole goal is to bring this sense of order, right? There are certain expectations you have when you call 911. That's someone who is, again, professionally dressed, is going to, treat you with kindness and respect. It's going to come and deal with that situation. There's, examples I can think of. You run into, oh, that just looks horrible. What am I doing? Right? That's not going to instill that confidence that you need to take care of that patient. The patient is also influenced by a lot of things that you do. So they need to express their fears and concerns. And we need to listen to people. Transport parents with their children. Again, I mentioned that earlier, but that's always advisable. Most policies will have that parent sit in the front seat. It's always going to be up to whomever that person's riding in the back is, but we want to make sure they do get transported with you. Violent situations, again, cops, call the cops, call the cops. the civil disturbances, large gatherings. I worked it was a long time ago, the Wycliffe Jean concert, and that was kind of crazy. Didn't expect a mosh pit in the middle of that thing, and people were, a little rambunctious, if you will, but that's, certainly a potential for a violent situation. On the domestic disputes, again, this is a squabble between two people, and there's no, I would say PCSO or TPD officer there. It's advisable to have one. So law enforcement should secure the scene before you enter. And that's just an example of scene safety, right? It can be chemicals, it can be fuel, it can be gas. It can also be, a domestic dispute. As far as evidence goes, or a crime scene, walk into an apartment not far from where my house is, and shotgun, okay, he's obviously dead. There's decomposition or body flesh that you can smell. Okay, that's a crime scene. Again, there's no reason to run into that person who is obviously been decomposing for the last 3 days. It'd be nice if they had their air conditioner on in that time, but they didn't. And so sometimes it's going to be painfully obvious that there's not a lot you can do. So exit the scene, make sure the cops are called, and that's really the best we can do for crime scene preservation. Behavioral emergencies don't always have this clear physical cause, but it's someone that's having some unusual behavior. But right now we got to think a little more critically. It may be something physical. So I don't know if you've ever seen a diabetic or someone who, has that really low blood sugar. Think of the Snickers commercial. Oh, you're not yourself when you're hungry. Okay, is that the reason why that person is now having this unusual behavior? There are certainly other things with behavioral emergencies, psychiatric disorder, on medications, or the medications they took too much and now they're toxic. It can be a lot of things. So it's obviously use caution, but one thing I would add when dealing with, potential psych patient or behavioral emergency is be prepared to spend extra time on scene. It's okay, you want to do everything that's safe. So sometimes there's this conversation we have to have with the patient. If they're experiencing some psychiatric problem, they may not, trust you. We want to make sure people can always see our hands, but use caution. And if needed, that's what the police are for. In workplace issues, cultural diversity, right? We have, all different types of students. We have different races, different religions, male, female, whatever it is, right? That's just something that you need to become accustomed to, right? Everyone should be treated respectfully. And it does not matter where they come from, what they do. They're sharing that same profession with yourself. But just be aware that there are people that are different than you are. Sexual harassment, there's 2 examples. Quid pro quo, Latin, that means this for that. So you do this for me and I will give you that schedule that you've been wanting. The other one in the hostile work environment is inappropriate jokes or things saying something that could offend someone else. So again, just be aware that those are there. As an example, and again, I'm just going to give you a recommendation. If someone were to say something and I might find that offensive, I'm going to tell them, hey, you know what, be careful, you don't know who's around, this is offensive to me, please make sure it doesn't happen again. And if that doesn't work, well, then it's time to kick it up the chain, if you will. So just 2 different things on the quid pro quo and then the hostile work environment. Workplace issues can include substance issues. So these are things that should not wait, right? If you have or if you suspect that maybe your partner is still drunk or really hungover because you can smell this coming out of their pores, right? Is it really safe for you to get into an ambulance with that person? Same idea goes, what if you get to a scene and that patient's looking at your partner because he just looks like he's been rode hard and put away wet? Those are things that we cannot have that in this profession. So again, it's hard to do, but sometimes you just, it's better to say something and be wrong than to not say something and be right. And then there's all these other consequences that can roll from that. Suicide prevention, again, more on resiliency training, is that suicide rates in EMS, fire, police happen to be a lot higher than those national averages. So again, this is, it's unfortunate, but it would take me two hands to count the number of people that we've lost either as partners or co-workers in this field. The injury and illness prevention. So illness prevention programs, they want to make sure that you are healthy, that you can continue to do this job, and so you can in turn provide that good care for the patient. This is a review, and again, I'll always run through the first one with you, but no, these are things that you can certainly continue and do at your own pace. So if I ask you a disease that can be spread from person to person is known as what? And you're thinking about it, you're like, is it infectious? Well, infectious was in the first title of the slide. Communicable disease, person to person, communicable, that sounds right. Is it transmittable or is it a spreadable? So again, based on the best answer that you see, I'm hoping you would press B or choose B. Because B, a communicable disease, can be spread from person to person or form one species or another, such as the tick as your vector. And again, it goes through and gives you the rationale for that. Looks at A, and then it tells you that B is, of course, the correct answer, and bing, bing. So that is actually chapter 2. Appreciate you hanging with me on this one. The Peter Chen is actually done chapter 3, so I know you'll see him for that. You should also be excited that Tyler Cole is someone that we have had employed for a long time. He is headed up to PA school, but before he actually starts his first class, he's going to have some lectures on the human body, the respiratory system, his degrees in physiology. So we thought it was a great opportunity for him to give back to some of these potential or incoming students. All right, that's all I got. Thanks.